Hello, I'm Dr. Jenny Andrus, and welcome to Joint Ventures. This OSC original podcast is your go-to for information on the latest headlines in pain and orthopedic medicine. Ketamine has been in the news as a recreational drug, responsible for deaths like that of Matthew Perry, but also as a potential treatment for chronic pain, depression, and addiction. There is so much interest in ketamine for pain that clinics have opened all over the country to do these infusions. Is it a dangerous street drug or a breakthrough in pain management? Let's get into it. The Cochrane Review recently made headlines when they said there was no clear evidence supporting ketamine for chronic pain. So the Cochrane Review is a group that uses a standardized way to synthesize studies to answer medical questions. We talked about this more on a previous podcast when we looked at the Cochrane Review on antidepressants for pain. If you go back to that episode, we explain how the Cochrane Review works, so you can go back to that for better details. But briefly, the Cochrane Review takes different studies trying to answer a question and then uses a standardized way to try to analyze these studies in aggregate. Recently, they looked at 5 different types of medications called NMDA receptor antagonists. The NMDA receptor is an important receptor in the nervous system that is implicated in learning, memory, and synaptic plasticity. So this receptor has been a target for treatments for Alzheimer's, depression, and pain, as well as for anesthesia. In the pain world, we have known that this receptor is important in a lot of painful conditions, but there is especially an interest in neuropathic pain or in generalized widespread pain like in fibromyalgia. In this recent review, studies on ketamine, amantadine, dextromethorphan, amantadine, and magnesium were all evaluated. A total of 67 studies were included, with 39 regarding ketamine. There was no clear evidence that intravenous or IV ketamine reduced pain intensity, and some evidence that it increased risk of side effects. There was no evidence that oral ketamine reduced pain, but no evidence on adverse effects, and there was no clear evidence that topical ketamine helped pain, but also no evidence to support side effects. The data quality here is pretty poor. So when the headline says ketamine is not beneficial, it's not because no benefit potentially exists. It's because the study data is just really poor in quality. To say it another way, this review does not say that ketamine is ineffective for chronic pain. What it says is there isn't good evidence of benefit. And while there wasn't clear evidence for benefit, there was some evidence that at least in IV ketamine, delusions, delirium, paranoia, nausea, and vomiting could occur. Ketamine has been studied in postoperative pain. There were moderate decreases in the amount of opiates a patient needed for pain control when they also got ketamine. Patients who got ketamine also were less likely to develop persistent post-surgical pain. In acute pain, there wasn't necessarily better pain control with ketamine compared to opiates, but the pain relief was faster. So what would proponents of ketamine therapy say? Certainly, there is anecdotal evidence that it works for some people, and most researchers or practitioners who use it a lot would say it's not a standalone treatment, meaning just getting a ketamine infusion by itself with no other treatment doesn't work well. At least in the mental health world, the idea is that ketamine promotes neuroplasticity. So during this time that it's active, the brain might be more malleable. And during that time, cognitive behavioral therapies and pain reprocessing might be more effective. Ketamine is often touted as a good option in patients with chronic pain, as well as opiate tolerance. So in some patients who have taken opioids for an extended period of time, the opioid actually starts to produce the opposite of pain relief. It starts to cause pain. The patient becomes so sensitized to pain, they start to feel more pain, and it's often more widespread and more severe. And when this happens, increasing the opiate actually makes the patient worse, not better. In these patients, ketamine has been shown successful in reducing high-dose opiate requirement and allowing for tapering. My opinion, I've always been kind of cautiously optimistic. I've been around long enough to see a lot of hyped treatments that fell flat. I do think ketamine has promise to help patients who are actively engaged in mental and physical therapy to get a boost or sort of like a jump start. I think this can be particularly helpful if a patient has a lot of anxiety or kinesiophobia along with the widespread pain. When a patient is just so overwhelmed with pain and it makes them so scared to move and especially anxious, this puts the body into that fight or flight, and it makes it really difficult to make headway with traditional therapy. In these instances, I think ketamine has potential to at least bypass this a bit and allow a motivated patient to start doing the things they need to do to get better. Ketamine does have risk, and certain patients should not get it. Cardiac risks are the most concerning to me. So in patients with irregular heartbeat, uncontrolled high blood pressure, heart failure, coronary artery disease, they just should not get it. So basically, this cuts out a large portion of my older patients. People who are active in substance abuse should not get ketamine, and in fact, many centers will require drug testing to be sure that the person is not actively using before they receive it. Because of the psychological effects, it shouldn't be used when someone is actively manic or having delusions or hallucinations, since it could worsen these. When it comes to ketamine, I think there is potential here, but it's not standardized and it isn't a standalone treatment. Although the data doesn't clearly show benefit, it does not. I think that has more to do with the poor methodology of the studies, and with more interest, I'm hopeful that studies are going to give us better answers. Thank you for listening. I hope you learned something. Please rate and subscribe. If you see a headline you want explained, let us know in the comments. Wishing you good health and see you soon. Bye-bye.
At Orthopedic and Spine Center, we're dedicated to providing the highest quality treatment using the most advanced technology available. Our fellowship-trained spine and interventional pain management physicians specialize in diagnosing painful conditions and offer minimally invasive interventions to complex spine surgeries. Our pain psychologist helps patients understand and reduce stress from chronic pain conditions. Our experienced physicians get you back to doing what you love. Call today for an appointment. Experience excellence at Orthopedic and Spine Center.